Well, hello everybody. I'm glad you're here today. My name is Dr. Paul Schulz, and I'm blessed to be the director of the Neurocognitive Disorders Center at UTHealth in our Neurosciences section. I'm going to address a bunch of questions today that I typically get in clinic to give you information about them. The first, probably the most common one, is what is dementia and what do you do as a dementia expert? Dementia means that a person comes to us with a change in cognitive function. It could be anything. It could be that they're worried about their memory. It could be worry about getting lost. It could be word finding. It could be operating a remote control, anything like that. So dementia has a bad connotation to it, but it just means that a person has a change that they've noticed and that we might pick up on testing. The most common cause of dementia is Alzheimer's disease. So this is sort of like saying someone has a cough, that would be dementia, but there are many causes of cough, okay? And the most common one that we see after ruling out simple things is Alzheimer's disease. Alzheimer's disease is typically defined as having a change in memory, but it could be getting lost, or it could be a change in language or attention. So one area of change, and then an effect on their activities of daily living. So if someone says, well, my memory's gotten bad enough, I honestly can't balance a checkbook, or I'm worried about my driving, or something like that, that would be Alzheimer's disease. Now, of course, there's steps in between normal and Alzheimer's. There's something we call mild cognitive impairment, which means a person may be noticing one area of change, but it's not affecting their activities of daily living. They may still be going to work and so forth, but they're coming in to see us because of a concern about, is this something to worry about or not, okay? So it turns out that as we get older, and I'm not really young myself, so I'm very aware of this in my own life, and that is that things do change normally with aging, okay? So it is pretty common to forget where my car keys are. It is pretty common to forget why I went into a room. But how would we know then if someone has more than the expected amount of change? What I tell people is, well, how do you compare to your spouse and your friends who are your age? Because there's sort of good age match controls. So if my wife says, well, Paul's forgetting more than I am, well, that would be something that would cause me to want to go see my doctor. If she says, well, we're both forgetting about the same amount because we're both of the same age, then that would probably be less to worry about. We still don't mind evaluating people, but it's a little less worrisome when it's similar to everybody else the same age. Okay? So what are the symptoms to watch for? It's really any cognitive change, because even though memory loss is the most common way for Alzheimer's to present, number one, we see other things besides Alzheimer's, and number two, it can present other ways. Sometimes it's just forgetting where the grocery store is, or how to get there, or how to get home. Sometimes it's not understanding situations. A loved one may say, well, he was real smart before, but now when he gets directions to set up something in the house, he really can't figure out how to do it. That could be a sign. Disorientation is real common, and I don't mean disorientation for everything. It's usually disorientation today. So for example, this morning, someone forgot what time they were coming in. That would be real common, because time is changing constantly, the date is changing constantly. People with very early memory issues will forget that, whereas they'll still know who they are and where they are and all their loved ones and all that kind of stuff. The big thing I want to convey too is, if you're having a hard time deciding between normal aging and worry about something, just come in and see us. Don't be embarrassed. If you're normal, I'll be happy to tell you that. But God forbid there's something going on, it's much better to be seen early than later on, and we want to see people early so we can figure out what's going on with them. There are lots of causes that we see of cognitive impairment, anywhere from mild all the way up to dementia. Alzheimer's, as I mentioned, is the most common, but people do get bumped on the head, skiing accident, car accident, etc. Aging changes us. There's a couple of genes that can be involved in causing someone to have changes early on. Unexpected vascular disease is common. So you'd think that everybody would know what a stroke is. I get weak in the left arm and leg, and everybody kind of knows that nowadays. But sometimes the strokes occur in parts of the brain that aren't involved in the motor system. So instead of getting weak or numb or having a problem with vision, they come in and say, well, my memory's not as good as it used to be. And when we do imaging, we might find strokes in them. Once in a while, we find a benign or worse brain tumor. Substances can be involved in producing cognitive change. Vitamin deficiencies and hormone deficiencies are both actually fairly common causes of cognitive issues that people come in and see us for. When we see someone, the evaluation is really designed to pick out which of those dozen things is most likely, okay? So I'll do a brief cognitive screening clinic. I'll give you like 30 questions, test memory a little bit, language a little bit, drawing a little bit, etc. And then based on that, it gives us an idea of what to do next. Commonly, we'll do blood work to rule out the vitamin deficiencies, infections, hormone deficiencies, etc. Very often, we'll do an MRI of the brain just to rule out things like little strokes, tumors, abscesses, hemorrhages, infections. And then depending on the situation, we'll often do longer cognitive testing. Not to be cruel, because it is kind of a tough test, but we do the long testing because, believe it or not, it's still our most sensitive test to figure out what's going on with someone and if they have a cognitive change. We can test a person's memory, for example, and compare them to people the same age, language the same way, etc. So we can say, for this person's age, they're normal, or one of the areas of function is different from that, and this gives us a clue about that. Depending on all these things, sometimes we're done, but sometimes we go on to other types of imaging nowadays: metabolic PET scans, amyloid PET scans, tau PET scans. Once in a great while, spinal fluid, but don't worry, that's not very common. Is our workup painful? Not really. Most of the stuff here, the most painful thing is that we ask you a lot of questions, and that's usually not very painful. So don't be shy about seeing us because of that. It's a pretty benign process, and we work with you through the process to explain what we're doing and to help you understand it. So how do I prepare for my appointment to come see us? Well, we will do it with you. We will give you lots of stuff in advance. And the reason is that it's very hard when we get in clinic to remember everything, like what medications I'm on and what the dosages are and how long I've been on them, etc., or what my family history is or what my exact allergies are. So we'll send you a very long packet of information with questions ahead of time, so you have the time at your leisure to think about all those things, and then send them in to us about a week in advance. We can look through them, and then when you come into clinic, instead of focusing on those things, we can focus on what you've been noticing that brought you into clinic. We'll also spend probably an hour with you, the first visit and the subsequent visits. That would be an average amount of time. Sometimes there's a little extra, etc. But it takes about that long really to get to know someone and to go through things and to explain things and to come to a consensus about what's going on. Please also, if you've had any testing before, please bring it in, because we can look at that and use that in a very valuable sort of way to decide where to go next. And a lot of times we'll compare the new results to the old results to see what's going on. In other words, there's a wide range of normal, and sometimes we can't tell if testing is normal for you individually, but if we have your past testing, we can use that to say, oh yes, this is the same as you've been, or this is a little different, we need to worry about something. Please also know that I have learners with us every day in clinic. We have medical students, residents, and fellows. It's real important for them to learn what we're doing. Apologies that there'll be a couple of people in the room with us, but as you can understand, it's really important for the next generation of healthcare providers that they learn at our side how to do this kind of stuff. We'll have brief COVID screening, of course, before you come in clinic. Obviously, as with everybody in the world, we want to make sure we're not exposing anybody needlessly to anything. So we'll give you a bunch of stuff in advance, and then when you leave, we'll give you stuff to take home with you, explaining what's going to go on and how to get the tests done. And then before you come see us again, we'll call you and say, hey, did it go okay? Were you able to get the MRI? Where was it? Please bring the MRI in if it's not at a place that I can visit online, et cetera, okay? So one of the really big questions I get in cognitive function is, you know, with all due respect to you, Doc, should I come see you? Is there anything you can do about it? And I have to say, 30 years ago, that was a valid question. There wasn't a lot we could do at that time. Now I would make the argument that we do have medications that have an impact. There's things we still can't cure, but there's things we can have an impact on. We will use the currently proven medications with you. We will go through risk factor management. What I mean by that is we've discovered things that make, you know, even if someone has Alzheimer's, we've found things that make it progress more rapidly or slowly. We also can reduce the risk of developing Alzheimer's by addressing those items. And then our clinic really specializes in experimental therapeutics. What I mean by that is after we get you on the proven treatments, we will ask you if you would like to consider an experimental medication on top of that. These are ones that have gone through animal studies and phase 1 and 2, usually in humans. So it's a phase 3 trial typically, so other humans have gotten it, so it's not totally experimental. But the idea here is we're looking to see if we can find medications that have a bigger impact on the course of things. And so we will ask you about that. You're not obligated to be involved, but we will ask you about that. We also have a new medication that came out, FDA approved, just in around June of 2021, called aducanumab. It's the first FDA approved drug that affects the course of Alzheimer's. It's not a cure, but I'm really glad to have it because it does have a measurable effect on the course of things. And we're going to keep doing our experimental therapies for other drugs, but in the meantime, I'm glad that for those that aren't interested in experimental therapy, we can offer this medication. And of course, we have people that may opt for both of them at different times. Okay? So for all of these, by the way, we need to see people very early. Once things have gone on, we're just not smart enough yet to find things that work. So don't delay in seeing us, because whether you go for aducanumab or an experimental therapy, we want to see you when you're having minor symptoms and not later in the course of the disease. So I get some people saying, well, you know what? Let's wait 6 or 12 months and see if it goes away. Please, I implore you, come see us right away. I want to see people early on, get them involved in things that we can work on, the things we've got that are proven, the things that are experimental. Oftentimes 6 or 12 months is a long enough time that a person's disease progresses, and I just can't offer the same medications to them. So please, come in early, and again, if it's so early that you're actually normal, I'll be delighted to tell you that. Don't be embarrassed about that. Thank you very much. Been a real pleasure, and I'll look forward to meeting you and your loved ones in clinic and guiding you through the whole process of being evaluated for any cognitive disorder that you might have. Thank you very much.